So, okay, so we're talking, obviously there's been a lot of discussion about the maternity ward, and I'm not sure if you guys sent out a small press release or something, because we had something that we ran on in the morning.
We had a statement that we provided.
So let's talk about, I'm going to have you reiterate kind of what the statement said, and then I'll ask questions from there.
So really difficult decision was made this week to close OB services and our NICU services. And so the statement talks about the closure of those services.
So why?
Great question. So all healthcare organizations are working with their boards, their providers, their leadership teams, and looking at the healthcare industry as a whole right now, the healthcare delivery system. Our current healthcare delivery system is unsustainable. We need to make changes to it. It's unaffordable, costs are rising, and people can't afford it anymore. And so as our board looked at the future of our ministries here in Arkansas, we came to three conclusions. One, we need to focus on the things that we do really well, and continue to invest in those services and grow those services. Second, we need to look at services that if we stopped providing, those services may not be provided elsewhere in the community. So specifically when you look at our inpatient behavioral health program, that's a program that doesn't do well financially, and yet at the same time, if we don't provide those services, we're one of the larger providers in the community, that would leave the community in a difficult place. And so we need to continue to provide that for the community. And then third, are there services that you provide that are well provided by others in the community where we're not the leader? And so that's where we looked at the OB and NICU program. There are other really good programs here in the community. And so that was why that difficult decision was made. Was that we could discontinue those services and they would still be well provided here in Little Rock.
Okay.
Now, what that doesn't mean that we're stopping providing OB in Catholic healthcare at CHI St. Vincent. So think about our program in Hot Springs, CHI St. Vincent Hot Springs. We're actually growing that OB program right now. We're expanding. It's under construction to grow, to continue to provide OB services for Southwest Arkansas, where there are fewer options.
Okay, so this is predominantly just
This is exclusively St. Vincent Infirmary here in Little Rock.
Okay. Let's talk about, I don't know a lot of details of this. This is just something I remember hearing. Did you guys recently redo or upgrade the maternity ward? No. Okay.
No, we're the maternity ward, the OB program in Hot Springs is being renovated right now to expand.
Okay, I think that might have been misconstrued by somebody. What does this mean for people who are currently, like, for instance, we talked about, I am currently a patient with one of your doctors at the women's clinic and expecting in April, so.
Yeah, great question. So, want everyone to know, we're not discontinuing women's services. That clinic is certainly going to continue. Dr. Owens, Dr. Shelley Gibbs, Dr. Ranganathan, they are open for business. There's no change for their patients other than over the next few months, we will discontinue doing deliveries here and they'll do their deliveries at one of the other programs here in the community. And we are working with those other programs to ensure a smooth transition. And so for expectant moms, have no fear that we are thinking about you. We're working with our providers. We're working with the others in the community to make sure that's a smooth transition when we discontinue providing delivery services so that those services are available for those expectant moms at those other facilities.
Okay, so even in the future, beyond the ones that are pregnant now, people who continue to get pregnant could come to the women's clinic here, receive those services, and then just choose to, or not have the option of delivering at either UAMS or Baptist at that point.
Absolutely, and people may not understand this, that already happens today. So our women's clinic already has patients that come to them and say, I would like for you to deliver me at Baptist. That already happens today. Now, they'll no longer be able to say, hey, I want to deliver at St. Vincent Infirmary, so that is an option that's going away. but people already are going to those doctors and delivering elsewhere.
What are you going to use the existing maternity ward for?
You know, we need to spend some time and look at that. Again, as I talked about at the beginning, healthcare is changing. So we're investing in our network. We're trying to invest in keeping people out of the hospital. So we're spending more time working on outpatient services, keeping people well, keeping people out of the hospital. But we're also looking at how do people who come into the hospital but may not need to be an inpatient, may not need to stay here 4 or 5 days. Maybe they only need to stay overnight and be observed. That's an opportunity for us. We need to add some observation capabilities, capacity to this facility for people that come in but don't need to stay very long. And so that's one possibility that we're considering.
Okay.
But we are expanding other outpatient service. So, in this particular example, we look at women's services. Yes, we're discontinuing the delivery component. We're phasing out the care of neonates. At the same time, we would like to grow other women's services, and many of those services are done on an outpatient basis. And so as we shift some of the inpatient acute care capacity to an outpatient capacity, that provides the opportunity to grow some of those services.
How soon will all of this stuff be changing? So like there's obviously going to be constantly babies in the NICU, constantly moms delivering. So how soon will that happen? Yeah,
so we've sat down with our providers and we're looking at those patient care lists. And this is a little bit organic. It's you put plans on paper and it doesn't always work out that well. We would like to discontinue delivering by about March 1st. The reality is the situation's a little more fluid than that. We need to make sure that between now and March 1st, we're able to provide those services safely for expectant moms and the babies. And so if at any point during this transition time between now and March 1st, we no longer have the staff to provide those services safely, then we would have to speed up the timeline in which we would discontinue those services. As long as we can provide them safely, we'll continue to provide them between now and March 1st.
And like for the other places that you would deliver or the other NICUs and stuff, they aren't going to be overfilled or there's not going to be enough space to meet those needs once this closes, correct?
So as part of this process, I've reached out to the chancellor at UAMS, to the CEO at Arkansas Children's, to the CEO at Baptist, let them know about this difficult decision, tried to make sure that we had a good conversation to make sure that it wasn't going to create an unsafe situation here in the community. They all assured me that they had the capacity, the capability, and the willingness to take those patients.
Do you have any questions, Chris? Do you think that there's something else that you would want to add, maybe an area that I didn't cover? Are there other departments besides just the neonatal and the maternity ward that are going?
Not at this point, but again, as I mentioned, as we looked at that strategic plan, we're looking at everything we do, and again, we're trying to shift the focus from being about the hospital to keeping people out of the hospital, to offering services differently. And so as we do that, this will be a process that continues in healthcare for the next 5 to 10 years. So yeah, there will be other changes in the future. Another one that you didn't ask about, but I think is probably pretty important, is what about the coworkers, right?
Yeah.
So let's talk about that. So our intention is not to displace our coworkers, and that's a really difficult one to talk about. So we're obviously impacting nurses, staff members that have experience in OB and taking care of babies, really experienced team here, a legacy of providing those services. We're impacting their lives. We would like to be able to help those folks reposition within our organization here in Central Arkansas, and so that may take some re-education for people who have focused in one area to be able to transition to another area. We want to work with our team members that want to do that to help that happen. There are going to be people that are passionate about delivering babies, taking care of babies, that are going to want to continue to do that. For those folks, we want to help them transition to other programs.
Mm-hmm. And that should be an option. I mean, you don't expect to have a large number of displaced employees with no job. Will there be any kind of severance?
So again, it's more about trying to work with people to find them a position internally, put resources to helping them do that. And then for folks that don't want to do that, are there positions at these other programs that are going to be growing as our patients transition from here to there? So our hope, our expectation is that people will either be able to find a position with us or elsewhere in the community.